watching ABC4 News on Utah's CW30.
Welcome back to the CW30 News at 7:30. Here's where we stand on the latest COVID-19 numbers here in Utah. 622 more people in Utah tested positive for the virus today. This brings our daily average number of cases now to 847, and our state's case total to more than 64,300. One more Utahn has died from the virus, bringing the state's total number of deaths to 441. 144 people are currently being treated in the hospital with COVID-19. However, more than 51,600 Utahns have recovered from the virus. Now, just 3 weeks ago, Utahns were able to get the rolling daily positive average down below 400 cases. But with the start of school, it appears this is driving the case counts up. And with flu season just around the corner, all signs point to a difficult winter. To help us explore the state's fight to slow the spread of COVID, we are joined with Dr. Matthew Wilson, immediate past president of the Utah Medical Association. Matthew, thank you so much for joining us on the show.
Thank you for having me, Ms. Nguyen.
So Matthew, we want to know what's behind this recent surge that we're seeing in the state.
Well, it would be really nice to have one thing to point to, but of course we know that reality becomes more nuanced than one cause for any change. Obviously we have the children back in school, the college students have returned from their homes all over the state and all over the country and come back to the college campuses. But there's also a lot more going on in the fall that can contribute to the rapid spread we're seeing right now. Obviously there are youth sports happening, and when students are connecting on campuses all over the state, they're also making plans to connect off campus. And as these activities are occurring, we're not seeing compliance with the recommendations that we know can help a lot in reducing the spread. And so, as we've seen the number go up, my experience and what we're seeing in the community is a lot of people taking risks that are, in my opinion, unnecessary.
Now, in other states, we've seen them implement statewide mask mandates, and we're seeing that correlates with lower case counts. So here in Utah, do you think that the governor and state officials should implement a statewide mask mandate?
Well, I speak on behalf of my organization, the Utah Medical Association, when I say yes. We've tried for many months now to make mask use voluntary and up to particular organizations, and some organizations are doing really well. I know that the schools which my children attend are doing a really good job at enforcing masks, and when students show up to school without an appropriate mask that covers their nose and mouth, they're being sent home or offered alternatives. In my office, we also are doing fine, but not all organizations have as much control of the coming and going from their facilities, their institutions, their businesses. In many cases, employees who have been hired to do particular jobs are now trying to ask customers and clients to wear masks, and that's not really their expertise. If all organizations across the state had the backing of the government, from the governor to the legislature and on down, I think it would do a lot of good. It would help them a lot and give them something to point to when they get resistance to the mask use.
Now, just looking ahead to winter coming up, we know that influenza and COVID-19 have very similar symptoms. In your professional opinion, how is this going to impact our fight against COVID-19?
Well, we're hoping that the flu season will be very mild. You know, we don't really know what to expect yet. We don't usually see, in a typical flu season, the numbers of cases increase until November or sometimes later. So it's hard to predict what's going to happen, but oftentimes in the United States, we follow a similar pattern to what is seen in Australia, because as you know, in the Southern Hemisphere, they experience winter before we do. And they've had an unusually low amount of flu cases. And obviously the reason for that would be our social distancing, the hyperattention to hand washing that we're doing, and obviously the mask use. We know that already in COVID-19 spread that the precautions that we can take to slow the spread are effective, and influenza virus is transmitted very similarly to the way COVID-19 is. So there's good reason to hope that we'll have a very mild case of flu in this state as we go forward. Obviously, as you mentioned, the symptoms are similar. So unfortunately, patients that have symptoms of the flu may be confused for a COVID case until the testing comes back. But fortunately, we have quite a bit of testing capability or capacity in our state, and we can test for both conditions.
Well, Dr. Wilson, I'm sorry to cut you off. We're running out of time right here, but we look forward to continuing this conversation with you in the near future. This is Dr. Matthew Wilson, of the Utah Medical Association. Thank you so much for coming in. Thank you for your time. We'll be right back.